Good afternoon, everybody. I'm Hakim Yadi, Chief Executive of the Northern Health Science Alliance. I want to talk through three things today. The first around the need for collaboration, provide you all with a bit of information about the Northern Health Science Alliance, and then to go through some worked examples of the work we're doing with North West Coast and the other academic health science networks across the north of England. We are in a great period of change, and the need for collaboration is being driven by those changes, whether it be the rising cost of delivering care, the move from a one drug for everyone to one of a personalized medicine, to one of having a patient-centric view of healthcare, or the enormous amounts of data that are now coming out through the healthcare system. And that is all in the backdrop of a huge amount of reform. And this is a snapshot taken from the King's Fund overview of the recent changes across the NHS. And what's been interesting to watch is how the different organisations have responded to those challenges and these reforms. From an industrial perspective, we've seen a lot of activity in bringing new products inside companies, a lot of in-licensing, huge amounts of defensive mergers and acquisition. I think the most famous one this year was the attempted takeover of AstraZeneca by Pfizer. But they've also not only been bringing products in, merging with other companies, they've also been changing the way they work. They've been looking to a new model where historically they worked as a fully integrated pharmaceutical, medtech or biotech company with very few external interactions. The evolving model is one where they're reaching out to big strategic partners, organizations like academic health science networks, organizations like some of the leading clinical academic centers we have across the north. And so the way they're changing their business model has to reflect the way we respond. But working across and delivering that sort of outsourced clinical academic research isn't easy. The clinical, the academic and the business communities do work in their respective silos. And being able to work between such organizations requires a certain level of agility. The SMEs in the room here who are working across the NHS, the universities, they need to be agile. And I always think they almost need to be like a racing yacht. So I race down on the south coast. And you have to be able to respond to the conditions. You have to be able to go move with the wind. And when the captain says tack, you tack as one, working together as a team. And that's how we'd all want to work. The challenge is that sometimes we're dealing with organizations that look a bit more like this. The command is given to move, but it can take many miles to make that transition. And if you're working in the depths of that oil tanker, you may not have even heard the command or even known that the ship was changing direction. And with that level of agility, working in an environment where you've got flagship pharmaceutical company 1, flagship pharmaceutical company 2, what can happen, unfortunately, is this. And I think why we're here today is to try and avoid these sort of events and actually be organizing the SME community, the biotechs, the NHS, academia, all working as one fleet. And that's what the Academic Health Science Networks and the Northern Health Science Alliance is trying to do. It's trying to bring together a community with the patient at the center. And we're very blessed in the UK to have a good and very strong combination of not only academic research, not only industrial research and a leading healthcare provider, but the research charities, which actually provide a real underpinning resource in terms of understanding the patient unmet need, understanding and acting as the broker and facilitator between the three different parties. And this all sits in the context of a new environment of electronic medical records, data, and e-health. So that's the backdrop to why the Northern Health Science Alliance was created. I just want to take a few moments to go through the alliance, and then I'll come on to those exemplars. So the Northern Health Science Alliance, for those of you who aren't familiar with it, is a fairly new organization. We formed about a year ago, and it brings together the 8 great cities across the north of England. It was formed by the medical research units within the research-intensive universities, the research-intensive NHS trusts, and the academic health science networks. So here's our members. But through the academic health science networks, we reach out to the whole health science community across the north of England, a patient catchment of 15 million people. The academic health science centres, the Liverpools, the Newcastles, the Leeds, the Manchesters of the world, act as that crucible of innovation. We work with the academic health science networks to distribute and spread that technology and innovation that comes through. We created the Northern Health Science Alliance to bring together that community across the north of England to establish the north as a go-to place for clinical academic research and industrial partnership. And the idea is that if it's good for the north, it's good for the UK. And we are positioning ourselves alongside Scotland and alongside the Golden Triangle as the 3 leading health science clusters in the UK, working together with our colleagues in the north, in Scotland, and down in the southeast. What's fascinating about the northern economy in health sciences and technology is that it is actually quite vast. But not much is said about the whole collective. It's often talked about the northwest, the northeast, the Yorkshire and Humber region. But actually, when you bring the whole of it together, you've got over 100,000 people studying medical sciences, 38,000 people employed across the north in health sciences and technologies companies, and a huge contribution to the UK economy. So we've got something that we should be very proud of, and we should be recognised alongside the other leaders in the UK. So I want to just take a few moments to talk through some of the collaborations we've got ongoing with the academic health science networks in the north of England. Now, for some of you, you'll recognise this schematic of the academic health science networks, highlighting their key strengths and areas that they're going to be focusing on. Some people look at that and say that's fantastic, it outlines exactly what the AHSNs are there for. But I have a slightly different view of the world that I want to share with you. I think that the academic health science networks are a fundamental part of a discovery engine, an engine that starts with patient need and placing the patient at the centre of the journey. Through hypothesis-led research and the work that goes on in the universities and NHS trusts across the UK, you generate new ideas, new technology. And that's where industry comes in, with finance, with expertise, and ability to distribute those technologies into market. The academic health science networks sit on the other side of that, pulling innovation through the system and driving it out from bedside to bedsides. And here we have the UK engine, academic discovery into the clinic, with the AHSNs pulling that innovation through. And the examples we've heard already today are highlighting exactly the role of Northwest Coast and the other AHSNs. You've already heard from Julian this morning about Proteus technology. We, as the Northern Health Science Alliance, partnered with Proteus back in February this year to look at how we could work with Proteus across the north. But how could that work? How could one company work with the north? Well, to do this, we started with a pioneer site, a site that would lead the way and lead the charge in creating relationships on the ground between Proteus Digital Health and the Northern Clinical Academic environment. So we started with Northwest Coast. So for the past few months, Northwest Coast have been working in close relationship with Proteus to look at how that technology could be adopted, and where it should be deployed within the Northwest. But through the Northern Health Science Alliance, we've actually been able to extend that relationship to other academic health science networks. And tomorrow morning at 8:30, we have our regular call that includes the Northeast and North Cumbria Academic Health Science Network, chaired by Northwest Coast Academic Health Science Network, where we discuss how the learnings can be transferred from one AHSN to another AHSN. And this is where the role of the AHSNs is incredibly powerful in making sure we don't continue to be plagued by the disease that does afflict the NHS, which is pilotitis. And to avoid pilotitis, we need our AHSNs not to work well in their own geography, they need to be working well with the other geographies. And through the Northern Health Science Alliance, we're doing that. We're doing it with Proteus, and we're also doing it with another company called Sectra. Sectra are a Swedish imaging company who have pioneered a technology in radiation dose monitoring and patient safety. Now here it wasn't Northwest Coast who originally took the lead. It was actually the Yorkshire and Humber Academic Health Science Network. So working with Sheffield Teaching Hospital Trust and the Yorkshire and Humber Academic Health Science Network, the AHSN and Sectra have been running, dare I say it, a pilot. 8 weeks on, and we've now got an open dialogue between not only the Yorkshire and Humber Academic Health Science Network, but also with Northwest Coast and Northeast Coast. So for me, the role and the function of the academic health science networks is critical in this new landscape, a landscape that is undergoing huge change, being driven by reform across the sector. And these 4 images really sum up how I see the academic health science networks. They're the signpost. They direct you to the people that you need to talk to first. They're the early adopters. They triage the laggards from those early innovators and put you in contact with the people that need to be at the cutting edge of your research. Fundamentally, they're the glue that's stitching together the clinical academic environment within each of the geographies, but critically working in partnership with the other academic health science networks. And I've also certainly found that they're a meeting of minds. It's a very fresh and refreshing approach to health science innovation. And working with the Northwest Coast and the other AHSNs has been a real pleasure over the past year as we've been creating the Northern Health Science Alliance. And on that, I'd say thank you for your time and look forward to speaking to you later today.